As we get older, regular medical checkups become an important part of staying healthy. Preventive care can help detect diseases early, monitor chronic conditions, and improve quality of life. However, there is a common misconception that more testing is always better. In reality, doctors today increasingly recognize that some screening tests and routine medical checkups may offer little benefit or even potential harm for certain adults over the age of 65, especially if the tests are performed too frequently, without symptoms, or in people whose overall health or life expectancy makes the screening unlikely to provide meaningful benefit. Today, we will talk about 5 medical checkups I'd never get after 65, Doctor explains. So, before we start, make sure to hit the like button and subscribe to my channel. Why more medical testing isn't always better. Many people believe that every available test should be performed as often as possible. However, every medical test has both benefits and potential downsides. Possible risks include false positive results, false negative results, unnecessary anxiety, additional invasive procedures, complications from follow-up testing, overdiagnosis, overtreatment, medical costs. Doctors increasingly focus on providing high-value care, meaning testing that is likely to improve health outcomes while avoiding unnecessary procedures. For older adults, this balance becomes especially important because some slow-growing conditions may never cause symptoms during a person's lifetime, while treatment itself may introduce unnecessary risks. Checkup #1. Routine SA screening for prostate cancer in every man. The prostate-specific antigen, or SA, blood test has helped detect prostate cancer in many men. However, routine SA screening after age 70 is not automatically recommended for everyone. Why? Many prostate cancers grow very slowly. Some men may never experience symptoms from these cancers during their lifetime. Screening can sometimes identify cancers that would never become dangerous, leading to biopsies, surgery, radiation, urinary problems, sexual dysfunction, and unnecessary anxiety. This does not mean SA testing should never be performed. Men with higher risk, concerning symptoms, strong family history, or after discussions with their physician may still choose screening based on individual circumstances. Shared decision-making remains the cornerstone of prostate cancer screening. Checkup #2. Cervical cancer screening after certain ages. Many women are surprised to learn that routine cervical cancer screening may eventually stop. Women over age 65 who have had adequate previous normal screening, no history of high-grade cervical abnormalities, no increased risk factors, may no longer require routine Pap tests or HPV screening. This recommendation exists because the likelihood of developing cervical cancer after years of consistently normal screening becomes quite low. However, women with previous abnormal results, weakened immune systems, certain medical conditions, or incomplete screening histories may still require continued monitoring. Stopping screening should always occur only after discussion with a healthcare provider. Checkup #3. Routine colon cancer screening in very advanced age. Colon cancer screening saves lives. However, recommendations change with advancing age. For many healthy adults, screening continues through the mid-70s. Beyond approximately age 75, decisions become increasingly individualized. By age 85, routine screening is generally not recommended for most people because the potential risks often outweigh expected benefits. Colonoscopy carries small but real risks including bleeding, perforation, sedation complications, dehydration from bowel preparation. These risks increase with age. People who remain exceptionally healthy with longer life expectancy may still benefit from screening after careful discussion with their physician. Checkup 4. Routine full-body CT scans without symptoms. Some companies advertise whole-body CT scans as comprehensive preventive health evaluations. While the idea sounds appealing, most medical organizations do not recommend routine whole-body CT scanning for healthy adults without symptoms. Reasons include radiation exposure, incidental findings, false alarms, additional testing, unnecessary biopsies, patient anxiety. Many unexpected findings discovered during whole-body imaging ultimately prove harmless but trigger months of additional medical evaluations. Imaging tests should generally be ordered to answer specific medical questions rather than simply searching for hidden disease. Checkup Check 5. Annual chest X-rays for healthy people without symptoms. Routine, yearly chest X-rays are another example of testing that generally provides little benefit for healthy adults without respiratory symptoms. Chest X-rays may be appropriate when evaluating persistent cough, shortness of breath, chest pain, fever, suspected pneumonia, known lung disease, cancer follow-up. However, using annual chest X-rays simply as a screening test has not been shown to reduce deaths from lung disease in otherwise healthy individuals. People at high risk for lung cancer, such as certain current or former heavy smokers, may instead qualify for low-dose CT lung cancer screening, which differs significantly from routine chest X-rays. Why individualized care matters. Modern medicine increasingly recognizes that healthcare should never rely solely on age. Two people who are both 70 years old may have dramatically different health. One person may run marathons while another may struggle with multiple chronic illnesses. Factors influencing screening decisions include overall health, life expectancy, functional independence, family history, personal values, previous screening results, chronic diseases, current symptoms. The best screening plan is the one tailored specifically to the individual. Medical checkups that remain extremely important after 65. Although some screening tests become less necessary with age, many preventive services remain essential. These include blood pressure monitoring, diabetes screening when appropriate, cholesterol management, vision examinations, hearing evaluations, dental care, vaccinations, medication reviews, bone health assessments, depression screening, fall risk evaluation, cognitive assessment when concerns arise. These preventive measures often have a much greater impact on quality of life than unnecessary testing. Don't ignore new symptoms. One important distinction often causes confusion. Routine screening applies to people without symptoms. If new symptoms develop, diagnostic testing becomes appropriate regardless of age. Always seek medical evaluation for chest pain, persistent cough, blood in the stool, blood in the urine, difficulty swallowing, unexplained weight loss, persistent abdominal pain, new lumps, changes in bowel habits, shortness of breath, confusion, persistent fatigue. These symptoms deserve prompt medical attention even if routine screening has previously stopped. Questions to ask before any medical test. Doctors encourage patients to ask, why is this test recommended? How will the results change my treatment? What are the risks? What are the alternatives? What happens if I decline the test? Is there evidence this screening improves outcomes for someone my age and health? These conversations promote informed decision-making and help avoid unnecessary procedures. The importance of lifestyle over testing. No screening test can replace healthy daily habits. Doctors consistently recommend regular physical activity, balanced nutrition, healthy body weight, adequate sleep, smoking cessation, limited alcohol, blood pressure control, blood sugar management, stress reduction, social engagement, routine preventive care. These habits often contribute more to healthy aging than frequent testing alone. Common myths about preventive screening. Many myths circulate online. One myth says Everyone should undergo every possible medical test every year. Another claims screening is useless after age 65. Neither statement is correct. The reality is that preventive screening remains valuable, but recommendations evolve based on scientific evidence and individual health. Medicine continues moving toward personalized care rather than one-size-fits-all recommendations. If you liked this video and would like to see more like it, please give it the thumbs up, leave a comment and click the button to subscribe.